Welcome to the TelePT Connections podcast. I'm Daniel Seidler, and my very special guest today is my friend David Freed, straight from España today. David is with Evolv, and Evolv is a rehab devices company looking to gamify rehabilitation, traditional rehab, and increase access at home. Welcome, David. Great to have you.
Well, thanks, Daniel. I appreciate being here.
Yeah, I forgot to mention, David's actually the CEO of Evolv. That's kind of important.
Not important.
Okay, well, people should know.
Least important job in the company, as I always say.
People should know, and I'm sure you have a great team. Is the company actually located in Spain?
We are indeed. We are a Spanish company. We work internationally, so our solution has been used in 20 different countries around the world, and we have a really important footprint in the UK. So we do a lot of work in the UK, whether it be research and using it as a test bed. And in fact, we're probably going to be opening up an office this fall in the UK as well.
Excellent. I mean, I'm sure, not to get too much into policy just yet, but I'm sure that poses lots of challenges in terms of different healthcare systems. Every country is different. Clearly, we've had conversations previously about getting into the US. And I know that the US healthcare system is significantly different than anywhere else you operate. Speak to that a little bit. Tell us the differences in the places where you are now.
Sure. So I mentioned to you that I'm actually Canadian. I'm not Spanish by birth. So the healthcare system in Canada is quite different to our neighbors in the South. Right. And in fact, you'll find in most of the world, the healthcare system is you walk into a hospital and they provide you healthcare without asking you whether you have health insurance. So yeah, it obviously, what it does is basically changes the message that you're going to have to who you're speaking to, right? So if you're talking to a doctor in a public healthcare system where they're not for profit, they're not worried about reimbursement or anything like that, the big question is how are we going to save them money? So how is our solution going to save them money, right? That's really what they're looking at resolving. Obviously the quality of care, obviously, what is our background in terms of, validation and stuff like that. But that whole reimbursement model doesn't even come into play. Right. Frankly, in most of the world, that's the situation that we're dealing with. So that's, that health economics model is quite important. And then when you go to the States, you have to change sort of your stance and what you're providing, and making sure that that whoever uses your system can, they have a code, there's a reimbursement code that could basically make sure that they get paid. I remember, funnily enough, when I was in San Francisco one time, and I went to a fairly important hospital. I don't want to name names. And before I could even press the button to show them what we were doing, the first question from the neurologist, the head neurologist, it was a stroke rehab service, was, so how do I get paid for this?
Yep.
Right. That was the big question. It wasn't, can you make the blind see? Can you make the deaf hear? No, that doesn't matter. How am I going to get paid for this?
Yep. So
that's obviously a challenge, but you have to, in each country, you have to work within the parameters that they give you, and that's why in fact, and we talked about this, what we try to do in each country, because we can't know about the healthcare system of each country, is work with the local partner, and they can take care of that, the ins and outs.
Yeah. So tell us exactly what Evolv is and what your products are about, and what you're selling when you go to all around the world.
Yeah, so Evolv is a medical device manufacturer that specializes in rehabilitation technologies. We're actually a spin-off of a larger company which is called Virtualware. And the origins are quite interesting. So back in 2011, the company Virtualware, which is sort of a software engineering company, they develop products, sort of bespoke projects. They were asked by a local patients association for people with multiple sclerosis about the idea of developing a therapy game, right? So this is back, well, this was actually in 2010. So this is a long time ago. They had been using traditional, video games. They'd been using the Wii, they'd been using the Kinect games for Xbox and so on,
Yep.
as a way of augmenting the amount of therapeutic activity the patients were doing in the clinic. You know better than anybody, Daniel, that therapy can be boring sometimes,
How dare you?
painful, often. I'm sorry. I'm sorry. I probably
No,
get
totally,
I get the
totally
hook.
agree. Got to keep it fun. Got to keep it fun
Exactly.
at all times.
Absolutely.
Any
So
therapist will say that.
that's it. So, and you go to many clinics around the world and they have an Xbox in the desk, or a Wii box, and
Yep.
that sort of
Sure.
gathering dust. But that idea of using sort of an enjoyable manner of increasing therapeutic activity is not new, and they were doing that. Now, with multiple sclerosis, it's a bit different, right? It's neurodegenerative. So unfortunately, people get worse. That's just where it's going to go.
Yep.
It's a disease of the young, which is also sort of a double whammy. So they thought, these games are great because we're dealing with young people, but there was a great issue. There was a great problem with it, which was basically the patients would see their physical decline reflected in the score of the game. So if you can imagine, they were playing the Wii whatever, and they were scoring 1,000 points 6 months ago. 3 months ago, they're scoring 600 points, and this month they're scoring 300 points. That affects a patient psychologically.
Yeah.
They see their decline being reflected in something that
Wow.
was enjoyable a few months ago.
I never considered that. That's yeah, I'm sure that's a big challenge that you need
Absolutely.
to consider in all your
Positivity, right?
development. Yeah, yeah, of course.
That's it. So that
Yeah.
was the issue. So they came to us. I said, listen, we have three big requests. One, we want to develop a game. It has to look like a game. It has to look like
Yeah.
you got it with the Kinect Xbox. So we were going to use the Kinect as a motion capture system because it's very easy to use. So we said, okay, it's got to look like a regular Kinect game. Secondly, as a therapist, we want to be able to control certain parameters, how hard it is, where the patient's reaching to, how far they need to reach. Are we working the left side or the right side? Is the patient seated or standing? So they wanted to control certain parameters that they couldn't do with a normal game. And the third point, which was quite important, is they wanted objective data, right? I don't want to see how many zombies they killed, right? That doesn't interest me. I want to see the range of motion. I want to see their the time on task. I want to see their response time. I want to see things that really show me that if they're progressing or declining, so that I can then change the level of difficulty, and I have all that control. And that was the basis of our product, which was called VirtualRehab in that moment. And so we started off with a very simple game with a stick person touching these targets. It was really,
Sure.
really simple. But the patients loved it. The patients absolutely went for it because they saw the difference between a normal, what they call AAA game that they would buy, at the store, and a game that was specific for them, that was working on that part of their body, that they were having problems
Yeah.
in that part of their disease, and they really appreciated that. So we did a clinical trial. In fact, they did the clinical trial with fantastic results. Improvement in static balance, dynamic balance in terms of reach, things like that. But there were also some really interesting pieces of the data that we found really pretty fascinating. One was the decrease in the level of anxiety and the decrease in the level of depression. So we didn't even think about these things because
What
we were
made you
young.
even measure those things?
It wasn't us. It was the clinicians. So
Okay.
they'll do the typical, fatigue level. They'll
Yeah.
measure,
Gotcha.
mood, things like that. And so they just did whatever they would do in a traditional study, and they just tacked it onto the study of this virtual
Okay. Gotcha.
therapy game.
Yeah.
And the patients said themselves that when they got in front of the game, it was them against the game. They forgot that they had MS. They forgot that they were in a clinic where they were surrounded by other people who were doing activities and stuff like that. They were focused 100% on that, 10 minutes that they were playing on the game, just as the way that they'd be doing in a normal game. And what that did was that when they walked through the door of the clinic that day, their anxiety level would go down because they knew that there'd be a little bit of a, respite at the end, a little bit of a prize at the end of their hard
Yeah.
work and,
Yeah.
that painful rehab and so on, that they'd be playing a game. And that helped them. And so that was really a powerful message for us. And then the other thing that was really interesting was they asked us, the patient asked us, when can we take this home with us?
Mm.
Telerehabilitation, huh?
Mm.
We never, what is that in
Right.
2011?
That's right.
So all these light bulbs started going off. So we, the company never thought about developing a product around it because it was a project and, they go on to the next project. But the results of the clinical trial were so great, the interest of the patients was so great that we saw that there was this opportunity to develop, let's call it a platform for therapy,
Yeah.
starting with this one simple game, right? And that was sort of the basis of EvolvRehab, which in that time was called VirtualRehab. So basically, fast forward to 2021 in this wonderful world of COVID that we're living in, and EvolvRehab is really a digital therapeutics or whatever, digital therapy platform, whatever you want to call it, health and wellness, that is focused on providing therapeutic activity to patients of different types of pathologies, whether it be MS, we work a lot with stroke, we work a lot with Parkinson's, with traumatic brain injury, doing a lot of stuff, healthy aging, fall prevention. And the idea is that we can deliver this therapeutic activity, whether it be in a clinical setting, but really our goal, going back to 2011, when we get this home, is out into the community. Now that could be a residential care home, that could be a community center, or that could be directly in the patient's home. And again, going back to COVID, telerehabilitation has changed, as you know, better than anybody. Telerehabilitation didn't exist before, right? People came to me. I don't go to the patients.
Right.
I don't provide service to patients in their home. Why would I do that? Well, that's all changed because it's out of necessity. So, we started working on this beforehand. Our first tele-rehab project was in 2013 in Russia, of all places. And we've been doing little projects in tele-rehab, but now the doors have been blown wide open.
Yep. That's truly fascinating. I mean, one thing, just to go back, I was thinking about if there were a video game that were made just for me.
Yes.
It just seems like such a unique idea. In that, I mean, I'm picturing playing Pac-Man, and if it was designed, exactly how I would want it for it to be easier, or if I needed certain challenges, just whether it be cognitive or physical, whatever it is. I don't know. You've taken that to a more applicable level, but just the concept of having a video game that's made specifically for you, that's just pretty cool.
That's right.
To me.
Yeah, I mean, the idea is well, let's not say that it's made specific. It's customized, it's personalized
Right.
to your needs. That's it, exactly.
Sure.
So the idea is that, if you're a stroke patient and you're hemiplegic on your right side, well, you know what?
Great example.
We're gonna force you to use your right side, whether you like it or not. It's a version, we talked about this. This is a virtual version of CIMT, right? So the idea is that rather than using the traditional form where you tie the person's hands up with a baking, a mitten, an oven mitt, or tying their hands.
We would even sling a patient. Yeah.
That's it. Well, you don't need to do that. You
Yep.
just basically, what we do is we use a color code system. So right is red, left is blue, a target appears. And if it's red and you're hemiplegic on that right side, you're going to be using your right side because you want to get the points. And it's really powerful because the patients, as we said, they forget that they have a disability. They forget that they compensate 99% of the time, and they go for it. So I think that's
so
key to what we try to do.
On the provider side, is that very easily programmable? Most PTs don't want to be playing around with technology too much. So how easy is the user interface for providers?
Yeah, it's so we worked. So keep in mind that all the development work we do is always in conjunction with therapists, with neurologists, with researchers, and with patients. Those are our testers.
Yeah.
Those are the ones who provide us. We don't invent the wheel, right? So we just take a look at what's being done. So what we try to do, again, and one of the other things that the therapist said is that they don't have time. You know better than anybody. There's not a lot of time between patients, so you don't want to be, programming. So what we're doing is we have a series of little boxes that you have to tick off. So again, if a person is hemiplegic on the right side and you want to make sure that all the targets that are going to be appearing that they need to touch are on the right side, you just click a button and away you go. If you need them to do a repetition 10 times of a specific target, you just press 10 and away you go. So it's a really simple setup. The idea is that what you do is you set up templates of the activities, and then you're going to see patients with similar characteristics.
Sure.
So you use those templates that have been preset. You might tweak them a little bit. This person's hemi left instead of hemi right, but you already have it set up. And it's really, really simple. That lends itself, the future is using things like artificial intelligence, where, based on the results of the patient, that the the machine sets up the activities accordingly, and the therapist signs off. I mean, it's really important for me to stress that what we do doesn't replace a therapist. It is a tool,
Right.
it's a technology tool in your toolkit to actually just improve the therapy process. And that's it. We don't go beyond that right now.
I mean, and obviously allows the patient to manage their own care on a certain
Absolutely.
level, right? I mean, that
That's
is
it.
one of the objectives, right?
That's really powerful. So we
Yeah.
talk about the idea that when we deliver our hardware system, which is called the Rehab Kit, into a patient's home, we very often tell the patient, you know, we're giving you the keys to the car, right? Which is, we're giving you the freedom to take care of yourself and go where you want to. And that's pretty powerful for patients who, you know, most of the time they're being taken care of. They don't have any sort of sense of autonomy anymore.
Yep.
And we're telling them, you know, you press the big blue button on our Rehab Kit, and away you go. And that changes, you know, that translates to the rest of their life. And
Yeah.
we're getting feedback from not only patients, but their, you know, their spouses, their caregivers, that they see sort of a change in their mood and their change in their attitude,
Yep.
that they think that they can start doing things on their own now. And that's, I think that's pretty
Pretty
powerful.
cool. Yeah, definitely. And the rehab. So talk about the Rehab Kit. That's the product.
That's it. So that's so we have a hardware software platform, right? So the idea is, how do we input the information of what the patient's doing so that our software can read it? So we have two basic, let's call it two basic ways of reading the movement of the person. We use the Microsoft Azure Connect camera, which
Okay.
is sort of the new version of the Connect from the day.
And
You
that
know,
was
when
the
people,
Microsoft video game back
that's right. Now
that
what they've
didn't
done,
last very long.
well, it had a good, run. It sold 25 million or 30 million
Oh, that's it. Okay. All right.
units. Not too bad, not too shabby. But for Microsoft, that's, you know, that's just a
They did
loose
stop.
change.
They stopped selling it though,
They
right?
stopped manufacturing it, right?
Okay. It was a niche
And what they,
market, but
yeah, they just thought, okay, you know, we're not going to develop something for consumers. And what they did was they sort of took, well, they developed sort of a new technology. It was just
yeah.
sort of completely starting from scratch, which is the Azure Connect, which is basically body tracking, which allows a camera to recognize movement in space of a person. So it recognizes the arm moving forward, it recognizes, you know, the body tilting, the legs moving up. And the idea is that it tracks 32 joints or
That's
points in the
amazing.
body.
Yeah. That's
Translates,
3D tracking
that's 3D tracking, exactly. So it allows us,
without the
no,
the
forget about that. You stand in front of it and
reflectors
nobody knows.
or whatever else. Yeah.
That's right, the little balls and things like, no, the idea is that you stand in front of it, you have the little, you know, grandma in the Bronx. This is not going to put on these little balls or
No.
put on a sensor or anything like that. She just presses the button, stands in front of it, and away she goes. That's the concept. So what happened was Microsoft brought out this new Azure, which is still a developer's kit. So it's not a commercial product as of yet, right? The important thing about its name, the Azure Connect, is Azure is the cloud platform for Microsoft. So the idea is that this Connect is sort of like a doorway or a portal into cloud services of Microsoft, right? So that's their idea. It's not for, you can't buy it for video games. It's a industry, you know, product.
Yeah.
That's sort of the idea. So we were looking before this, so of how could we simplify the onboarding process for a patient, meaning how could we make it as simple as possible to start using EvolvRehab, right? Before, we were using the old Connect, which had a lot of cables connected to a laptop that needed to be, so, you know, if you can imagine in your living room, cables all over the place, well, you know, most
I
people
can
don't
show
like
you
that.
pictures of the video of that if you want.
I can imagine, but most people don't like that, Daniel.
Oh, okay. We'll stay away.
So what we wanted to try to do is basically integrate everything into one box. Let's call it that, the Rehab Kit.
Right.
Big blue button, and then you start your rehab. That was the concept right from day one. We've been working with Microsoft for many years, and in fact, the CEO of Microsoft, Satya Nadella, saw our product back in 2014 when he was visiting an organization that we work with in Santiago de Chile. Okay, his son has cerebral palsy, and they were treating kids with cerebral palsy, and he saw this activity which was using his product, the Connect,
That is cool.
and he said, "Bingo, I like this." And so, and
I
now
like this. We did this.
yes, exactly. Yeah, exactly. Yeah, a little company
That's
using our technology did
that's
this.
amazing.
And so he talked about our product, in 2016 at an event, and we started working with Microsoft in the UK, and one thing led to another, and we contacted Microsoft about what we were doing, which was we were taking this new Connect and we were creating this Rehab Kit for telerehabilitation and stuff, and they loved it.
Yeah.
So they got on board, and they've been promoting our, if you go to some web pages of the Azure Connect, you'll see information about us. Satya Nadella spoke about what we were doing as well. So this has been, we work directly with Microsoft, which is great for us, because they see the future. The future is, is being able to provide care anywhere. It doesn't have to be in a hospital setting. It shouldn't have to be in a hospital setting. Certain things need to be in a hospital setting. We're not replacing therapists. But there are other things that you, as a healthcare professional, know that in order to get good patient outcomes, you need to deliver it outside of, you can't be watching the patient 24/7.
Right. That's right.
And that's really what we're trying to do.
Yeah. I mean, as PTs, we see patients 1 to 3 hours a week, maybe, right? And the rest of their lives is up to them.
Exactly.
Do they do their home exercises? Do they has their ergonomic setup at their office? Do they bend over and lift appropriately and safely, and however else they take care of themselves? Do they sleep well? So what the future of healthcare and the future of, I guess, human health, like what do you envision, and where does Evolv fit into that? Big question.
Big question.
Big question. And
Yeah.
Let's start with the big question. And
Sure.
like without Evolv or without products,
Sure.
whatever, just what
Sure.
do you see?
Well, I think, again, there's nothing like a good pandemic to sort of open up people's eyes, right? I think, again, this philosophy of they come to us, we don't go to them, has changed forever. And I think the reason being is because in many cases, I mean, you cannot do brain surgery remotely, can you? So, I mean, there's certain things that still require the person to go to the hospital. But there are
That's only a matter of time too, by the way.
It's only a matter of time, exactly. That's right. Leave that to Jeff Bezos. Maybe there's something in there for Amazon Prime, right?
Yeah.
I think the issue is that there is a whole series of healthcare services, whether it be in psychiatry, whether it be in physiotherapy, and other things that can be delivered safely, effectively, outside of the hospital setting. And again, it could be in a community, it could be in a community care facility.
Yeah,
It could be
yeah.
in a care home, nursing home, or it could be directly in the patient's home. So I think, and companies like Microsoft and a lot of companies have basically, have really changed their roadmap in terms of product development to be able to fulfill those needs. So just to give you a simple example, Microsoft Teams, I know we're using Zoom, but even Zoom as well. I mean, who heard about Zoom before the pandemic? Nobody. And Zoom, obviously, as well as Microsoft Teams, has sort of a healthcare service as well, right?
Yep.
So this was not the idea when they first came out. It was for people to chat about, whatever at home. Now we have to make sure there's HIPAA compliance. There's got to be all these things
Yep.
that effectively can be, allow these solutions to be incorporated into a healthcare delivery model. So I think that for me is the most powerful thing, this idea. And the second thing, and you mentioned this, making healthcare patient-centric, right? I think
Definitely,
the
right.
best way for a person to get better is to give them the tools, first of all, give them the education that they need to use those tools correctly, and then let them get on with it. Now, that doesn't have to necessarily always be the case. It might be the caregivers. Maybe there's a patient who can't take care of themselves because they're in a situation, but they can't. But again, you have your formal caregivers and your informal caregivers, and very often it's the informal caregiver, that the husband, the wife, the parent, the in-law, that have to take care of people in the home setting, and they suffer greatly because of it as well. And I think if we can give them tools to help them, in a way, provide healthcare
Yeah.
in the home, everybody wins. We're going to have a healthier population. We're going to have a lower healthcare costs. Obviously, that's going to mean lower, premiums in terms of insurance there in the States. But I think it's a win-win situation. So for me, those are the two big things: the decentralization, or the democratization, or whatever you want to call it, healthcare.
Sure.
And secondly, the importance of providing the right tools, and giving the freedom to patients themselves or their loved ones to actually be part of the healthcare delivery model.
That also leads to access and engagement.
Absolutely.
And I think that's where something like Evolv comes in, right? Like your products come in where you're making it fun and it's easy. You know, you talk about giving the tools to caregivers, informal caregivers, you know, without making it sound too simplistic. I mean, they just press the button, the blue button, and you know, the patient can go through their routine for
That's it.
that day.
That's it.
That's
That's it. I think it's again. I mean, as you said. I mean, we try to simplify it to the maximum. It's not as simple as that
yeah,
sometimes.
yeah.
But the idea is that we know that in order to be successful and
Excuse
in
the
order
quick
to
interruption.
sure.
Excuse me. Have a great day.
Chop chop.
Yeah, that's okay. That's my daughter. She
No
needed to
worries.
use the office printer.
No worries.
You can come and grab it when you need to. Okay. Um, the you were talking about access at home, right?
That's right. I mean, I think the idea of providing greater accessibility leads to a greater dose of therapeutic activity,
Yeah.
which eventually leads to improved patient outcomes, and in between there, reduce healthcare costs. Right. So, just to give you an idea, in 2020, the World Health Organization released a report on rehabilitation. First thing that they said, that rehabilitation basically is a right, a fundamental right to
Sure.
medical services. It's not a luxury.
Yep.
Now, it is a luxury in many places, even like in places like the States or in other countries, but some people just can't afford, going to a therapist, unfortunately.
Yep.
But 1/3 of the world's population suffer from some sort of condition that can use, some type of
You
therapy.
can
They
benefit
require
from
therapy.
therapy. Yeah, yeah.
That's right. And they don't
Even
have,
in the States, I mean, we had to fight. I mean, it was a state by state issue, I guess.
yeah,
But as essential workers, physical
absolutely.
therapists, that really
Absolutely.
had to put their foot down and be like, of course we're essential workers. I
It's
mean,
a no-brainer, right?
yeah,
For us
right.
and for a patient, but for somebody who's never had to get therapy.
Yeah.
And one thing is that you have to get therapy because you were skiing, down the bunny hill, and whatever, you broke your knee, and you need to do,
You know my
lots of,
history, huh?
yeah, I was going to say a lot of flexion extension of the knee and stuff like that. That's one thing, but deal with a person who has multiple sclerosis. That therapy is a daily essential part of their
Vital.
life.
Yep.
If they don't have it,
Yep.
their disability is exponential.
Yep.
Talk to a person who suffered a stroke. If they don't get the rehab in time, after having that stroke and
Yep.
continuous, they're not going to get better. That's going to affect them, their family,
Sure.
the economy of the country. So there's a lot at stake.
Yep.
And as they said, it's not a luxury. It's a right. And the other thing is that the population is aging.
Yeah.
Right? You and I just aged while we've been talking.
Getting older every day.
And the issue is that obviously, I don't know about you, but you notice that the knees start going and the balance
Right.
isn't as great as
Right.
before, and you're still young and healthy, eh, Daniel? So
You
I don't.
working on that every day too.
You're working it.
The last time we spoke, you mentioned something to me about I don't know if it was a case study about or a wider study than that, patients who had a stroke and continue to do. We typically, I mean, the U.S. model is you get I don't know, 30 days in a sniff, additional 60 days or 30 visits in outpatient PT, and then
Right.
you're on your own.
Yeah. Good luck, buddy. Yeah.
Exactly. Good luck with that
Yeah.
hemiparetic arm.
Exactly. Yes. Exactly. So, and that's even the case in public healthcare as well. So, I mean, it's sort of,
Right.
and the really strange thing is that stroke patients tend to be incredibly motivated, because
Right.
within the bad that is stroke, there is that possibility through lots and lots of hard work, which means
Yep.
lots of reps, right? Lots and lots of reps.
Yep.
There is that possibility of improving quality of life, right? Which you can't get perhaps with Parkinson's or MS or other neurological, diseases or conditions. So stroke patients, the ones that we've worked with, are incredibly motivated. So again, when we say, here it is, take the keys, away you go, they put in the hours. They put in the reps, and they love the fact that they look at it as going to the gym. The gym has come to them. That's what they say.
Yeah, sure.
They say, after finishing 30 minutes of this, I'm knackered. I'm exhausted, but it's that good exhausted that you feel knowing that, you've done something that's making you healthy.
Yep.
And that's really important. So yeah, so we're doing a couple of projects in the UK where we're working specifically with stroke patients. And these are chronic stroke patients, right? We're not dealing with somebody who's just gotten out of the acute ward, or subacute ward. These are people who had strokes 6, 10, 15 years ago. So they've been written off, right?
Mm-hmm.
That, as you said, that hemiparetic arm, that's the way it's going to be for the rest of your life.
Right.
Forget about it. That's not the case. And there are studies, including one by the University College of London, Queen Square, who we work with, who basically what they have is a boot camp for people with stroke, chronic stroke very often, for 3 weeks, and they throw everything but the kitchen sink at them. 3 weeks
Yep.
of 6 hours a day,
Yep.
and the results
6
speak for
hours a day.
themselves. 6 hours a day, right?
Great.
So and
Great.
you know better than anybody, for example, stroke, it's multidisciplinary.
Yep.
Physio, PT, speech and language, but they really focus on the upper limb.
Mm-hmm.
But that's the secret ingredient is giving them the opportunity to put in those reps at high intensity, high dose, at home,
and specific to the patient, of course.
and specific to the patient. Exactly. And the results speak for themselves. So we have patients who couldn't bend down, couldn't stand for more than 2 minutes, who couldn't move their arms, who weren't able to concentrate. And we didn't reinvent the wheel. We just took what was happening in a therapeutic setting, in a hospital or center.
Yep.
And we just sort of kind of brought that concept home with them and gave them more of it. That was it.
Awesome. You have a video.
Oh, I'm going to try it.
Let's give it a shot.
Let's give it a shot.
And this is pretty much what you were just speaking about, right? This is a patient who has had a stroke.
That's it.
And they are using.
So they're just to give you context. So they're using EvolvRehab at home. They have I think bi-weekly sessions with their patients. So tell me how you see this.
I see the avatar in a gym.
That's right.
So anyone
that's
who's,
the gentleman.
if you're listening on the podcast, this will be posted on YouTube. Check it out. We're at like minute 40 of the podcast, somewhere around there.
That's it. So this gentleman had a stroke, affected mostly his lower limb. So the therapist has designed a series of activities for him to really work the lower limb. And you'll see him here. So there's the Rehab Kit beside the TV.
Yep.
Here's the gentleman who could only, stand for a couple minutes at a time before. He's doing.
First of all, pause for a second.
Sure.
That little white box.
Yeah.
Can you even go back?
Yeah. Let me see if I can go back.
It amazed me when I first saw it.
That's the Rehab Kit.
Yeah.
Big blue button, right? So
that's
what he presses every day.
It's smaller than an Xbox.
It is, yeah. It's exactly. So the Connect is quite diminutive and it's really tiny.
It's amazing. And that's tracking the patient's movement as
as you can see here.
Yep.
His movement. So when he moves his leg, it moves its leg. The avatar moves its leg. So the great thing about providing this biofeedback is that they see what they're doing correctly and what they're doing incorrectly. That's really important to them, right? So there's no hiding the fact. But what we don't do is we don't take, an image of themselves. We provide sort of a neutral, neither male nor female avatar.
Mm-hmm.
And then the person plays in these 3D styled games, different types of activities. And we've worked, we've worked with people of all ages from 6 to 97. And who doesn't love playing games? So there's a little bit of gamification, gives them information about how well he did, number of reps. It's really important to keep the patient informed, right? They're the end client for us, and so in this case, the therapist is actually speaking to the patient, in this case through Teams, giving them information about how well they're doing and so on. So that's basically it. And they have their calendar. They have I talked about this sort of this idea that we treat patients as elite athletes, right?
Sure.
The idea is that if you do your tasks and you win a trophy, and we want to keep the patients motivated.
Yep.
So that's we haven't reinvented the wheel. We've taken sort of bits and pieces. It's like a potpourri of stuff.
Well, so many applications for that. I mean, first of all, that the data, you're collecting data.
That's it.
Right. So that data you can apply to improving the product.
Absolutely.
Apply to new products, population health, all those kind of things. And secondly, I mean, I like the idea of asynchronous telehealth. So can a patient record their session, or like how does that work?
Right. So we don't have that right now, but that's something that's on our roadmap, because that's one of the things that more than patients, therapists have actually saying that they'd be interested in having little snippets of being
Sure,
up, because
sure.
again, this is all done remotely. Therapists, again, in this case, the therapist connects every 2 weeks to the patient for maybe half an hour. The idea is that the patient is working autonomously. They know they're working autonomously. They know that the therapist is following them, sending them
Right.
messages, et cetera, et cetera. But the idea is to start recording small snippets of what they're doing so that the therapist can say, so I see that there's compensating over here and they're not lifting up their
Yeah.
leg properly. So there is that possibility. Have to keep in mind, there's all the question of, HIPAA compliance and, patient data,
Sure.
privacy concerns and so on. But, that's a really powerful tool as
So
well.
you can aggregate data,
That's
I
it.
assume.
Yes, exactly.
And the therapist gets results, meaning they see the stats
That's
and
it.
they can see progression, everything's charted or graphed or
That's it, exactly. So the most
that's
important,
awesome.
like right from the start, they see, is there adherence to treatment, first of all?
Yeah.
Okay, so they've adhered to treatment. How are they doing? Where are they having problems? Are they having issues with one part of their body more than the other? Can I tweak the program to make it a little bit easier or more challenging for them?
Yeah.
And then the idea, again, I mentioned this to you. I mean, our concept and what we're working towards is creating sort of this health and wellness channel, right? So it's not just therapeutic activity. A really important element of therapy, holistic, approach to it,
Mm-hmm.
is on one hand providing information and education to the patient. So in that same channel, it's not just therapeutic activities, but it's information about the stroke, information about, multiple sclerosis, what you're suffering. It's adding things like, for example, questionnaires and surveys as well. And then really important for us, and again, you're a PT, but this as sort of part of what you do, that that patients receive multidisciplinary treatment, right?
Yeah.
So you have a PT, OT, speech and language, and the idea is that we want to reflect that within EvolvRehab. So a patient can get this very holistic approach to treatment, lots of activity, and then the therapists use one system, right? They don't need to use all these different types of applications and systems. They have one system that they can go to and treat the patient, whatever the condition or syndrome they have, and work towards, a certain goal with them.
Yeah. So who's your best customer? Like who's your target customer?
Our target customer, well, our end customer is the patient, but we don't sell to patients themselves. So usually what we do is we sell it, depending on the context of each country, but usually it will be the hospital system, it will be the private rehabilitation center,
Yeah.
it will be the care home where they want to add fall prevention to the activities that the older adults are doing at home. So we have this structured fall prevention program that we developed in conjunction with Mount Sinai Hospital there in New York. And then in certain countries, like for example, in Spain, they have sort of a very interesting concept, which are patients associations, which I mentioned, where we started, that will treat specific conditions. So there'll be a Parkinson's patient association in different parts of the country. And there they will provide, a whole host of services, which include therapy. So they'll be interested in that as well. So
I'm trying to picture that. Is it like a Parkinson's center?
it is, exactly.
Oh,
So
that's amazing.
yeah, so it's great. So imagine your father has Parkinson's. He can no longer be at home by himself. So you need to, I don't want to say park, but you need to have them do, something interesting and useful to them during the day that where you can't be with them. And so what they'll do is they'll go to these and again, they're nonprofit centers, and what they'll do is they'll provide a whole host of activities. It'll be everything from therapy, psychology, classes on doing activities, they'll have food, they'll have lunch there. And then, 5 o'clock comes around and they get picked up by their family or they get driven to their homes.
Sure.
And then the next day, the same thing. So it's a really interesting system of providing, this social healthcare service that's so needed. So they don't fall through the cracks, right?
Sure. And a center like that would purchase one of these and
That's
basically schedule 15-minute slots or 30-minute slots for people to just walk in with their caregiver or alone, walk into the room, press the
That's it.
button, their program comes up and they
That's it.
fire away.
Absolutely. Usually there's an
Self-guided.
auxiliary staff or something that will
Yeah.
just turn on the thing.
Awesome. Very cool.
And that's it. Yeah. So it's really simple to
Yeah, I mean,
onboard.
it's kind of like going to the gym,
It
you
is.
know, with a personal guide.
Yeah,
You know,
that's it.
it's not a PT there with you, but it is a specific protocol. It's amazing.
Yeah.
So I think we've talked about a lot of the opportunities. What sort of challenges have you faced? What sort of pushback have you gotten, and from who? Is it from patients? Is it from clinicians? Is it from?
No, I think most patients, I mean, you can't, all patients are not interested in using technology. I mean,
Sure.
that's just the case. But I think most patients, when they see the benefits, they're interested. So that's a very easy sell, right?
Yeah.
But again, we don't normally sell to patients directly.
Right.
So the idea is that we need to, and very often what happens is that the therapist at a local hospital or a local clinic will see our solution somewhere, whether it be, at the ACRM event or at, online or something like that.
Yep.
And they want to find out a little bit more information, the costs and so on. And then they basically will have to go to the higher ups who actually sign the checkbooks, right? So that's usually the way it works. And in most cases, and again, certain therapists love technology, think that it's a great tool to improve the lives of patients and improve delivery of care. And others just don't want to hear anything about it. So, there's certain people will like it, other people won't. But
you can't please everybody, right?
You cannot.
You're not
General,
selling to
right?
everybody. Yeah. Great point.
So that's it. But that's basically how we work and the challenges. And I think again we're making slow headway in the States. We've done some projects there, and we're working on some other projects. And I think there in the States the main challenge obviously is like who pays for it. That's the question. Is it out of pocket?
Right.
Is it the payers? If it is the payers, is it a part of a bundled package? There's and that's where we try to work with partners there who understand the laws of the land and the system that is the American healthcare system, and obviously that would mean changing certain aspects of the product to work better within those confines. But you can imagine the American healthcare system, the market there is huge.
Yeah.
So I think there are a lot of interesting opportunities, and there's great interest in providing remote care. Congress seems to be, I keep hearing these rumors about Congress is working on these packages to.
That's what they say.
Yeah, it keeps getting watered down from what I hear.
Yeah.
But anything is better than nothing.
Yeah.
And you're there. COVID is not going anywhere. We keep hitting it over the head with a hammer, but it pops up in different places. And this idea of remote care, as I said, I mean, I think one of the few good things that come out of COVID was that it's opened up that door finally.
Yeah.
Finally,
for sure. And going back to payment models, particularly in the United States, I mean, it's so obvious to me that Evolv and other products like it. I've spoken. We've had Eric DeYoung on here from Trazer. They're a little more. Well, I mean, they have different modules, but similar technology, similar protocols, definitely different delivery. But we've had this conversation multiple times that it's really obvious that products like this can really can increase the capacity and efficiency, particularly in senior centers, nursing homes, skilled nursing facilities, rehab centers, places where people are there for rehab. And first of all, therapists are extremely valuable. They need to be working hands-on with certain patients for long periods of time, and other patients are a lot more independent and can really, if guided appropriately and put in the right environment with the right tools, can really manage their care, or at least portions of their care. But at the end of the day, it's like, how do we get paid for that?
Absolutely.
There's nothing built into the system that actually reimburses for that. And, the hospitals aren't run for free, private practices aren't free. Someone's got to pay the bills. And
Absolutely.
that's, I imagine in the United States, that is your biggest challenge.
It
Um,
is.
and, but, you know, I think you've come up with some pretty good solutions to it.
Well, I think, as you said, I mean, it is a challenge. We don't have all the answers. Are again, as somebody looking from the outside the window, looking in. Uh, but I think there's quite a few people or quite a few companies who've sort of cracked that nut,
Yeah.
and I think, as you said, I think if you can give patients greater access to care, um, those payers are going to be seeing benefits at the
Yeah,
end of the
for
day, and
sure.
it's not going to take a long time for them to see those benefits,
Yep.
because they're going to see that they're going to need to spend less money on delivering the more expensive care,
Yeah.
um, and the outcomes can be measurable,
Yep.
and you can and so you'll be able to see quite quickly. You'll be able to do that health economics model, saying, okay, I'm using remote care, I'm using traditional care. Where's that fine line that I'm actually spending more money or spending less money and
Yep.
getting the same outcomes?
Yeah.
And I think that's where we're at right now.
Yep. And similar to the incorporation of telehealth into traditional outpatient rehab, that's my world. Um,
Right.
I think a hybrid model will evolve, and no pun intended.
I
But
was going to say, we charge. I forgot to tell you, every time you say Evolv, we charge you for that.
you know,
You
I,
know.
I think it will
Yep.
develop though. It makes the most sense, and I think it's the most efficient and effective.
Yes.
There
Absolutely.
are ways to utilize tools to make you better, to make the provider better, to make the patient better, and cost effectively.
I was kind of
So
I was kind of joking and not joking about that. Sometimes it takes a bit of a shock to the system
yeah.
to make
Oh, for
changes,
sure. Yeah.
and usually those changes are for the better.
Yep.
So
Yep.
I think we're at that point right now, and I think hopefully, from what we understand in the States, that okay, so there won't be that same provision of telecare as there was during the height of the pandemic,
Right. Right.
but there are a series of cohorts of patients that really benefit from receiving remote care.
For sure.
And I think that opportunity is still there, and we need to take advantage of it, as do the patients, and I think the payers as well. So I think we have to all align our desires together and work towards it.
Yep. Um, Great story, great narrative. I've seen a full demo. You did a full demo that you demonstrated for me. I love the product. I like the design. I like the utilization of it. I haven't gotten my hands on it as a practitioner or a
Yeah,
patient.
hopefully it'll be coming
But
soon.
yeah, I mean, I can't wait. It's very cool. So congratulations on that. That's awesome.
Well, thank you, Daniel. Appreciate it.
It's always cool to see innovation, great innovation that's going to make a difference out there. Because I've been asking all the questions, you now get a chance to ask me a question if you'd like.
Well, yeah, I'd be kind of interested in what your thoughts are, because I mean, you come from the world of PTs. You've been dabbling in terms of the technology.
Right.
As a therapist, and objectively speaking, where do you see the role of technology? Do you see it as I mean, if you imagine out of 100% delivery to a patient,
Mhm. Sure.
where do you see what do you think it would be? Is it sort of a 50-50 mix? Is it still the therapist has to come first, provide a lot of that service, and just a very small? What are your thoughts?
Well, a couple of things. First of all, technology is broad. I think early in my career there was a push towards there was a lot of use of ultrasound and lasers and all kind that sort of technology.
Right.
And I think in certain situations there are devices that have their place, and the small portion of what most PTs do these days. As far as the type of technology that you've developed, which is basically augmenting care, sort of automating care even. I think there's a huge place for it, and I don't know percentage wise, and because it depends on the patient, and it depends on the stage of their rehab or the state or the status of their health. But the applications that you speak of, particularly things like um, stroke rehab, long-term stroke rehab, and falls prevention. I
Right.
mean, falls prevention is, it's study after study shows that an Otago, which is basically a Otago program, which is basically like a few exercises a day.
Right, exactly.
If you can make that fun and make that, and you know, it's all about adherence. It's all about the behavior of the patient
Sure.
actually engaging. If they know it, you know, 10 a.m. every day, they walk over, press their blue button, and they do their 15 minutes of exercise. I mean, that is a game changer. That is a game changer. You know, a fall is a fall is life-threatening for a lot of people. It's life-changing for other people. It costs $35,000 when all is said and done to the system. You know, $30,000 or $40,000. If you can prevent falls, that changes so many things. And these are people who probably are not getting, they're probably not in a falls prevention or rehab program.
No.
You know, that's really exciting to me. And that can be almost fully automated, right? I mean, you see that patient once a week, once every other week to check in as a PT, make sure they're doing things properly, make sure they're not having any issues, encourage them to keep going. I mean, you know, do our part, answer any questions, and have that, you know, 15-minute conversation to really catch up with the patient and put them back on their way.
So we check that box, do we, Daniel?
I think so. I think
Cool.
so. I mean, yeah,
Cool.
I mean, I told you last time we talked that that's the area that really interests me. I think that, you know, there's a major issue of falls
Absolutely.
you know, we have an aging population. So in this country, there's the falls are the number of falls, raw numbers are higher than ever. You know, I don't know what the worldwide numbers are, but you know, this is preventable, very preventable, you know,
Absolutely.
and
So
simple programs make a big difference. Simple as that.
So yep, exactly. So yep, we
great
our minds are
application.
aligned.
Yeah, absolutely. How can people get in touch with you? How can they find Evolv?
Okay, well, Evolv is EvolvRehab, EvolvRehab.com. So you can contact us. We have a little info and contact us there directly. And we'd be very happy to hear about, you know, from people all around the world, which we basically do every single day. So our goal is really to help people. That's the main goal of Evolv, if anything, is help as many people as we can while we can.
Amazing. And you're on LinkedIn, so I'll tag you on LinkedIn when we post the podcast. People can comment and they can speak to you if they want to. Cool. I appreciate you coming on, David. This is great.
No, Daniel, this has been a pleasure. It's great to be able to talk to people on the other side of the world, and that's right. Hopefully we'll be seeing each other soon.
I think so. We'll meet up in person soon.
Cool.
All right. Have a great day. Thank you.
You too. Bye.
Bye.